and today I'll be demonstrating how to do intradermal injections. For this skills video, we'll be needing gloves, a sharps container, hand sanitizer, alcohol swabs, gauze, the patient, the medication tuberculin, which is a 5 TU per 0.1 ml order, and the tuberculosis syringe, which is a 25 gauge 5x8 needle. The first thing we're going to do is verify the physician orders. The second thing we're going to do is verify the 6 rights of medication, which is the right patient, the right drug, the right dose, the right time, the right route, and the right documentation. After that, we'll verify the physician order with the EMR. The physician order states 5 TU per 0.1 ml, and the medication does match that. We'll gather our supplies and head towards the patient. We'll knock on the patient's door. The patient will allow us to come in. We'll close the door to ensure patient privacy. I will then introduce myself to the patient. Hello, my name is Pranita and I will be your nurse today. I will then verify my patient's identity using 2 patient identifiers. May you please verify your name and date of birth? The patient states their name and date of birth and I verify on the wristlet. The next thing I'm going to do is ask the patient if they have any allergies. The patient denies having any allergies. I will then tell the patient that I am here to administer a tuberculin injection. The tuberculin injection allows for detection if a person has been exposed to tuberculosis. Tuberculin medication does have some side effects. It can cause swelling and itchiness to the injection site. Some adverse side effects that are seen from tuberculin are hives and or shortness of breath. With intradermal injections, it is quite common to have the common side effects of itching and swelling. Do you have any questions for me? No? Okay. Next, I will perform hand hygiene and I'll apply my gloves on. Once I have my gloves on, I'll take an alcohol swab and prep the top of the tuberculin vial. While we wait for the top to dry, we can prep the tuberculin syringe. Again, this is a 25 gauge syringe with a 5x8 needle. We'll take the syringe out of the packaging. We will have the cap on and set the syringe to 0.1 ml. Then we'll remove the cap of the syringe. I will then inject the tuberculin vial with the syringe. We are not drawing up any medication. I will release the air into the syringe. I will invert the tuberculin syringe and we will draw up 0.1 ml slowly. While you drop the medication, be sure that there are no air bubbles present. If there are, just simply tap the syringe. Here, there are no air bubbles present. Next, I will recap the syringe with the one hand cap method. I'll keep the syringe to the side. Now I will begin to choose a site where I will administer the tuberculin shot. It is best to have 3 to 4 fingers below the antecubital area or have a hand's width above the wrist, so this generalized area. We will then examine the skin for any abnormalities, any rash, any open wounds, any bleeding. Then we'll palpate the skin to make sure that everything is okay. The skin is clear, there is no issues, so we'll choose the site right here. Now I will remove my gloves and I will perform hand hygiene. And I'll apply new gloves on. will then clean the area with the alcohol pad. We'll start from the center and move out 2 inches to the outer. We'll rub in circles, circular motion. Alright. Then, with my non-dominant hand, I will pinch the skin, but before doing that, I will grab the medication with my dominant hand and uncap it. I will then use my non-dominant hand and hold the skin tightly. We are going to inject the medication at a 5 to 15 degree angle, and we will go as deep as 3 millimeters. Then I will inject the medication into the skin. I will begin to take the needle out, and I will get my gauze and gently put it over the site, not applying any pressure. I will then dispose of my syringe in the sharps container. I will now clean up the area and remove my gloves. I will ask the patient if they are experiencing any side effects and check the site. I will then document the procedure that was performed and any findings that may I have found, as well as the condition of the patient and how they tolerated the injection. I will then make sure that the patient is left comfortable in a comfortable position and that they're safe. And if they have anything else for me or need anything from me, they stated no. So I will then thank them for their cooperation and exit the room.